Good morning. It's July 21st, and this is your daily brief in science. Here's everything you need to know. BMS is expanding its AI platform to support next-generation foundation models trained on its proprietary data, potentially leveraging NVIDIA's BioNeMo for biology AI and agentic workflows to scale hypothesis testing with human guidance for interpretation. The moves fit BMS's broader strategy to accelerate drug discovery, development, and operational efficiency through advanced AI and strategic partnerships, with the Vera-Rubin cluster underpinning development of these models and possible BioNeMo integration for biology-focused capabilities. This expansion follows an initial DGX superpod started about 3 years ago, aiming to speed target identification from weeks to days, while leadership emphasizes translating AI into patient outcomes, reducing manual work, and improving the likelihood that advancing programs are the right ones. A new American Heart Association statement says for most adults, moderate caffeine intake up to about 400 milligrams a day is generally safe and may be linked to a lower risk of several heart conditions. It also notes that higher amounts common in energy drinks could raise risks like high blood pressure and irregular heart rhythms. Brewing method matters. Benefits are associated with paper-filtered or instant coffee, while unfiltered methods retain cafeistol, which can raise LDL cholesterol and potentially offset benefits. Caffeine effects vary by individual factors like genetics, metabolism, age, and prior use, leading to a range from sleep disruption to potential protection. The statement, published in Circulation, synthesizes evidence from large cohort studies and randomized trials, with ongoing work to refine recommendations as new data emerge. The AHA also points out limitations of the supporting studies, most of which are observational, and calls for more randomized controlled trials to establish causality. Clinicians may need clearer guidance on caffeine consumption as public and professional understanding remains mixed, and recommendations may evolve. There is no scientific evidence supporting claims that caffeinated beverages stunt growth in children. Tea may offer cardiovascular benefits similar to coffee, but evidence is less extensive and calls for more research. England plans to ban the sale of high-caffeine energy drinks to under 16-year-olds starting next year, with a limit of 150 milligrams per liter. Softer drinks and traditional tea or coffee remain unaffected. National Coffee Association data show about 2/3 of American adults drink coffee daily, averaging around 3 cups, indicating widespread exposure. Public guidance emphasizes moderation and awareness of caffeine sources, as sleep disruption and overall health considerations persist, with average daily intake commonly around 200 milligrams for many Americans. Preparation and lifestyle factors, diet, sleep, and exercise, remain important even when coffee fits within a heart-healthy pattern. A multinational study led by EMBL Hamburg maps how influenza A virus reprograms infected human cells by directly charting virus-host protein interactions inside intact cells, using an advanced XLMS approach paired with AlphaFold modeling and reporting findings in Nature Microbiology. The work spans XLMS, glycoproteomics, AlphaFold-based modeling, and microscopy performed across specialized facilities at Charité, EMBL Hamburg, the EMBL Proteomics Core Facility, and CSSB. Key findings show how the early secretory pathway of HA interacts with ER chaperones, trafficking lectins, and Golgi enzymes, and how perturbing these factors alters HA maturation and viral replication. Glycoprofiling reveals site-specific changes in HA glycosylation when host processing factors are knocked down, outlining how host glycosylation steps shape HA maturation during infection. Functional SARNA screens identified host factors influencing influenza A replication, with RAB11A knockdown markedly reducing replication, and LAT1 complex components showing context-dependent effects. The SHVIP approach enriched newly synthesized viral proteins and exposed numerous viral host crosslinks, including interactions with RAB11A, KHSRP, TDP43, ANP32A/B, nucleosomes, microtubules, and chaperonins, underscoring functional relevance in infection. Dismantling paraspeckles, non-membrane nuclear compartments that store proteins and RNA, may release resources that aid viral production while dampening cellular immune responses, offering a dual advantage to the virus. Perispeckle's disassembly ties into broader observations that the virus reprograms host cell machinery to support replication, while potentially weakening defenses. The study suggests the methodology could illuminate antiviral targets and be applied to viruses of pandemic relevance, such as H5N1. Shared infrastructure across institutions supported XLMS, glycoproteomics, AlphaFold-based modeling, and advanced microscopy, illustrating the collaborative, multidisciplinary nature of the effort. The international collaboration was led by EMBL Hamburg, with contributors from FMP and Charité, including leadership roles for JANKOSINSKI and IULIIAKOTOVA, among others, and the work was published on July 20, 2026. A measles case in Delaware has been confirmed for the first time in more than a decade, an unvaccinated adult male in Kent County prompting contact tracing and an investigation. The case is connected to a regional surge tied to a Pennsylvania outbreak that has grown to over 100 cases with hospitalizations, testing links across nearby counties, and ongoing investigation. Extensive contact tracing is underway as the Delaware Division of Public Health notifies exposed individuals, checks vaccination status, provides educational resources, and advises on treatment if needed. Public health officials say the Delaware case underscores cross-state risk and the importance of vaccination for all residents, with vaccination access available at pharmacies, primary care providers, federally qualified health centers, and public health clinics. Residents are urged to verify their own and their children's vaccination status via the Delvax public portal for status checks and information. There is no antiviral cure for measles, but vaccination after exposure within 3 days can prevent or lessen symptoms, and antibodies can be provided within 6 days for certain high-risk individuals. The case highlights ongoing United States measles outbreaks linked to declining vaccination rates despite the vaccine's availability, with public health messaging stressing that measles is highly contagious and preventable through vaccination. Measles can cause serious complications such as pneumonia and brain inflammation, so anyone with symptoms should seek prompt medical care and inform providers of potential exposure. If symptoms appear or exposure is reported, the public should seek care and, if severe, seek emergency care. Healthcare providers should contact the DPH Office of Infectious Disease Epidemiology during business hours or via the 24-hour line for guidance, testing coordination, and exposure management. A new study in PNAS shows geometric reasoning spans humans and several non-human primates, suggesting geometric intuition may be an ancient cognitive feature rather than something learned only through schooling. Researchers tested 4 groups: rhesus macaques, olive baboons, U.S. preschoolers, and indigenous Tsimain adults from Bolivia, using a touchscreen shape matching task to probe perception and discrimination of geometric shapes. The findings indicate some monkeys process geometric relationships in ways that resemble human performance, pointing to shared perceptual codes across species rather than a strict divide. CMU researchers led the project with Rochester Institute of Technology, and the data, code, and videos are openly accessible. Editorial notes from Neuroscience News accompany the open access article, which includes a detailed abstract supporting the results. The study situates its work at CMU and Bolivia, noting forthcoming publication in PNAS. To contextualize results across species and cultures, the same tasks were given to preschoolers, American adults, and about 80 Bolivian Tsimain adults, helping to separate developmental from educational factors. The participant pool included dozens of American preschoolers, 21 American adults, and 79 Tsimain adults, enabling comparisons of developmental and cultural influences. The primate portal at Seneca Park Zoo supported open-access data collection and cognitive tasks for baboons, linking research with K-12 STEM programs. Cantlin's lab and the primate portal aim to integrate animal cognition studies with classroom learning and broader STEM engagement. The study highlights an exceptionally engaged baboon named Kalamata, who spent hours on geometric tasks after the experimenter activated the computer. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.